Cervical cancer, fortunately, has become a rare cancer in this country, and due to a very successful screening and vaccination program, we have cut down tremendously the number of women we are now seeing with cervical cancer. But there are still women who do not have regular smears or who have not been vaccinated and attend for cervical smears, where we pick up these issues more often than not. I believe that cervical cancer is completely preventable because the effective screening programs helps us to identify problems at a very early stage when there are mainly pre-invasive changes where we can treat and monitor so it doesn't progress into anything nasty like cancer. Hence, we must encourage all women to come and have regular smears, or to be vigilant about symptoms such as bleeding after sex, abnormal vaginal discharge, bloody vaginal discharge outside their periods, or bleeding between their periods as well. Sometimes the symptoms are not very obvious. If you're feeling discomfort and pain, or you're feeling a lump in your vagina which is not normal, then come and get checked by a specialist. Usually the smear is quite definitive in terms of reassuring you that there's no problem, or is diagnostic in telling us that there is a problem. Subsequently, if there is a problem, we perform a colposcopy and assess in greater depth the cervical changes and take directed biopsies to see if these are pre-invasive or cancerous changes. If they're cancerous changes, then we need further testing along with scans to stage the disease, and again, most of the cancers picked up through screening, if at all we do pick it up, are very early and can be cured with surgery. Some cancers, especially in the elderly, come to us at an advanced stage where they need to be treated with chemoradiotherapy. The bottom line is that if you feel that you're getting any abnormal bleeding in premenstrual women or in postmenopausal bleeding after sex, or any form of bleeding, you need to get investigated to rule out cervical cancer.